Well, hello everyone. Welcome to episode 13 of Cathartic Ruination. I am beyond excited today to have my first, lady guest and also my first professional mental health advocate to come and sit with me on the show. And how about you introduce yourself, my dear?
Hi, okay. My name is Jamie. I'm a nurse and I work in a community-based psychiatric setting.
Yeah.
So outpatient mental health.
Okay. And why don't you go ahead and we can just start with what we were talking about before we got cut off, like your history with your own personal mental health, and we can discuss that a little bit further because I think that's a good way to get comfortable talking about ourselves and talking about like, hey, we know about this firsthand. We also try to advocate for it in the field and be representatives and give resources, but at the same time, it's easier to understand when you've been through it firsthand. So,
and my experience is different than your experience, is different than other people's experience, but
definitely,
I think people don't realize how much mental health touches everyone's lives.
Yeah,
and we were talking earlier. I've struggled with depression my whole life.
Mm-hmm.
It's manageable with medication, but it's always there. But my first like inklings toward wanting to be in the helping field was my own struggles as a kid. I was diagnosed in second grade with Tourette syndrome, and I was medicated with adult doses of Haldol and Clonidine until I was 11, so just towards 6th grade.
Okay.
And at that time,
you said they were what, adult doses?
Adult doses,
Jesus.
Yeah, just real heavy. Like I look at some of the medications that are dispensed to some of my patients now, and I'm thinking, gosh, is like a single digit. I was on that much Haldol. That was
insane.
A lot for a little kid.
Yeah.
And I was finally taken to for talk therapy right before middle school, and the therapist spent a few sessions with me and was like, stop medicating this child. This is OCD. This is not Tourette's. So Tourette's, people think of, it's so much broader than what people think of. But involuntary motions, vocalizations, movements.
And you said that's more like neurological versus...
They would think of it as a neurological disorder now rather than a psychiatric disorder, the way they thought it. So I'm almost 36, and this is when I was 7.
Okay.
So it obviously the medical understanding of it is different now.
Of course, yeah, we've come so far compared to, what, the 90s
and that wasn't even that long ago.
Yeah, it wasn't, but you'd be surprised how much has changed and how much awareness has been brought to light at this point with I mean, I know you already know, within the last 50 years how much things have changed, and even within the last 100 years how much things have changed. There was a time frame where the best bet was to just, lobotomize someone and stick them in a facility, or they would just be your little house pet with,
So, interestingly enough, and you'll have to check my exact history on this, but one of the Kennedys, I think it was John Kennedy's younger sister?
Yes, it was his younger sister that was the father of lobotomy, the guy who is famous for it and who changed the procedure from the front, from the rear, I think it was rear to the frontal lobe. He did it on her.
Rosemary Kennedy,
yes,
I think.
Yes, that's right.
And, not that a lobotomy is a good answer at all or treatment for anything, but it sounds like this young woman probably had a mood disorder.
Yeah.
And what we would, easily treat with lithium now, her whole life,
Which I take lithium, so yeah,
Yeah.
I
mean, there's so many options. Lithium is just like a household name.
Well, just to say, now someone with my symptoms, I would be a candidate for getting lobotomized, and that's a realistic thing. That's something as simple that I treat with medication this day. Back then, that was the forefront of the medical field, and that was like the ideal solution, whereas they didn't have the same type of drugs back then as they do now. So yeah, like, it is amazing how far we've come from
However,
that point.
a few of the very effective drugs from back then are still around and still in use now, more than people realize. So, like, thank goodness for chemistry over physical lobotomy, because
I have to agree.
I mean, the results are much better.
I mean, yeah,
medication
and I please believe I'd rather have that as the option.
Absolutely.
But even still, medication. You're talking about kids being on them and everything. I know as an adult, all of my medications are sedatives, and when I am at my peak levels, and my medication nurse raises my meds and I'm zombied out. So I can't imagine how hard it is being a kid trying to learn and having your brain developing and being on that types of medication. So I don't even know, because I didn't get diagnosed with schizophrenia till my late 20s, and my bipolar in my early 20s. But I've always had like anxiety disorders and depression since like 10 or 11 is when I was diagnosed with those, and I was treated. I've had therapy since then too, so I've been doing therapy for like over 20 years now. And we were talking about that too, how hard it is to find a freaking therapist.
Yeah. I mean, insured, not insured, it's the one thing that I hear across the board between Medicare, Medicaid, Kaiser, Cigna, Aetna, United, uninsured, it is so hard to find behavioral health care.
Yeah.
Whether it's a psychiatric prescriber, such as a psychiatrist or a nurse practitioner, or if it's like a counselor, a therapist, licensed clinical social worker, licensed professional counselor. I'm like trying to psychologist.
Yeah.
And also some nurse practitioners do therapy as well. But like with all the different practitioners, it's just so hard to get the care, because, and this shows you how far mental health reaches into almost everyone's life, because we turn out all these professionals that do this, and it doesn't touch the demand. It doesn't touch the tip of the iceberg of the demand,
which is heartbreaking, and it makes you like not even want to try. That's the sad part. I mean, and it's worth it, like, if you can find something that works, and if it's sustainable. That's what we were talking about too, how hard it is to find sustainable care and be able to keep up with medications and afford it. And once you get on that routine, like, not everyone has access to those resources, which is why the facility that you work at is so amazing. When you were telling me about how you guys have a special niche when it comes to the mental health field, being court-based patients.
So some of them are. So I would say we have, give or take at any time, about a 65 client caseload.
Okay.
And that doesn't sound like a lot, but that's this is very, very intense treatment and community-based. So we are in people's homes. We help transport people. COVID's obviously made this, like,
I can only imagine. That's a whole separate show in itself, is the effects COVID has had on the field.
Yeah, and it's been really frustrating because we're used to providing this excellent, high quality, high resource, high impact care.
Well, of course, and that's what these people are needing, and that's why it works so well. Like, I can relate to that directly, because with my agoraphobia before COVID, I could have people come to my house and help me with something as simple as paperwork if I needed to go somewhere and I needed someone to be with me, just to, like, for court or for anything. I would have my caseworker actually be able to come and physically help me with these things. And that's the care that I needed to that degree, because on my own, I just wasn't getting things done with my anxiety disorder. It just was paralyzing. And now it's just not even possible for me to get that kind of care. I'm hoping at some point we can have those resources available, but everyone having to be home and then offices being shut down and stuff, like, God, I didn't even think about it from that perspective for everybody else too.
And it's been, so the team that I work for, a little bit about us, we take care of a severely persistently mentally ill, so the acronym for that is SPMI, population. So people who are chronically in and out of hospital, jail, chronic homelessness because of their mental illness is traditional modalities of treatment have not worked for our clients, and they are not getting better, and they're not having a good quality of life, just going from institution to institution to the street. So where a team like this fits in, and we are grant-based, fills a need that has an incredibly high impact for our community, because when I first came to this team 6 years ago, one of our main jobs was to keep people out of the hospital.
Yeah.
And because it is so much more cost effective to keep people stable in the community than it is for them to go to the hospital.
Oh yeah, that makes complete sense, because you're coming out of pocket to pay for the treatment for these people. So if they have the setup and the support system to actually stay out, it makes more sense. You guys actually can provide what's the word I'm looking for? Coping skills as well, teach them.
Well, and also our people, like, a lot of my people, you wouldn't ever know they were mentally ill, because they are stable right now on medications. They're working.
Yeah, and when people think of mentally ill people, they think of...
Yeah, it's a very what's the word I'm looking for? Maybe I'm going to make up a word. Media-ized picture of what mental illness is, and that's what just keeps stigma so strong, because it keeps people quiet as well. When you say mental illness, there's a picture we all have. It may not be exactly the same.
Yeah, but it's definitely not a realistic or positive image, especially in our culture, like westernized culture. And other countries, people who hear voices or have psychosis, it's a positive thing, and the environment's very supportive about it. But in our country, it is not viewed the same way, and that is unfortunate. But you having firsthand experience with people of this demographic can say that, hey, this is not the realistic
it's not even close. And I think that people are very reluctant to talk about their own, like, even you and we are both people with mental health struggles.
Yes.
But, like, might be hesitant to go ahead and stand up and classify ourselves mentally ill publicly. I mean, there was a time where I was hesitant. I'm very loud about it. I'm
proud about it. Yeah, I have to say that now I do, honestly, now I kind of am, I want to say I'm almost aggressive about it in some aspects, because I think it's important to give people exposure and to show that I'm not embarrassed about it. Now, privately, I do have my moments where I am sobbing on the bathroom floor, like, I can't do this. Why am I like this? I hate my brain right now, but when I'm out there in public and around other people, I definitely try to show that, even though I have these challenges, I'm not embarrassed about it. And that's something that people are not used to, because most people are scared to talk about it or ashamed, or if someone reacts a certain type of way, because when I say schizophrenia, people automatically think that I'm a serial killer, and I'm like, no, I've never stabbed anyone before.
Well, and this is something that we had touched on when we spoke before. Of there's a conceptualization culturally of dangerousness of mental illness, and this is another media-ized thing where what you think of as mentally ill on TV is not what the actual picture of mental illness is. And statistically, people, especially the people in the population I take care of with severe, chronic, relapsing mental illness, poorly controlled or not well medicated, like, they're overwhelmingly, statistically more likely to become the victims of a crime rather than a perpetrator of, or to be the victim of violence rather than the perpetrator of.
Yes.
And if there's just like one thing that I could convey to people is that mental illness does not equal dangerous.
Yes, it definitely does not. I mean, and there are, like, what would you say are warning signs to look for on both ends of the spectrum if you do have that case where someone could be considered dangerous? Because I'm sure you've had experience with that as well.
Yeah, and so anybody can become dangerous under
the right pressure.
Well, I would say the correct circumstances, but the incorrect circumstances, I think, can lead to dangerousness. So, like, I don't know any of my clients to be outwardly, well, that's not true. Most people are not aggressive. They're actually, very used to being passive and quiet because they're used to being told to move along by society, or you don't belong here. And there's this quietness, there's this silencing and marginalizing around that. And very rarely is it the other way around, where people are thinking. One of the worst concoctions for a dangerous situation, I think, is when people become paranoid.
Yes.
Depending on what they're paranoid about. Like, I know some people that are paranoid, so they don't answer their phone or their door. And so that's one type of paranoid. And then there's another type of paranoid where government agents are coming to get me, and they look all like all of us. And you might even be a government agent.
Oh yeah, those delusions will get you.
Yeah, and so that's something that can it can make for a dangerous situation.
Yeah.
But it does not unequivocally equal.
And those are the more rare situations, but the ones that are focused on. Whereas the reality is that there are people who have delusions like, I'm at Target and I have this delusion that I work here. So I stock and organize the shelves, and then the cops get called on me. And now I have, some type of disorderly conduct misdemeanor put on my case, on my file, and I'm brought in and I have to spend time in the system and not get treatment, which exasperates my symptoms. And that's the area where we want to bring awareness, and we want to bring destigmatize, so that people on a base level can look at that situation and be like, okay, it's not dangerous. Just because it's weird or I don't understand it doesn't mean we need to like completely destabilize this person's life just because it's something that's misunderstood. And is it really such a problem that they just move some things around on some shelves just because they have issues, you know?
The response to psychotic symptoms is really extreme sometimes. And there is a program that a lot of the officers in the city that I work in have been trained in. It's called CRT, which I believe is crisis response training.
Okay.
And I mean, police are not equipped, like in their general job description, to be handling mental health emergencies.
Yeah, I would have to agree with you.
They're
100%.
not equipped, and originally their training did not have anything to do with handling those emergencies other than get cuffs on, subdue, and detain.
Well, from what I understand, a lot of training and policies are also state by state, and that's for a lot of funding and a lot of facilities and a lot of regulations. But in our area in Aurora, with having we've had how many mass shootings within the last even freaking 10 years, but we have the Batman shooting. That's everyone knows about the Batman shooting. And then we had in Boulder just a few weeks ago, we had that guy who shot up that King Soopers.
Yeah.
So our area is very much aware of how much mental health is, how like training for people with these types of challenges and these types of imbalances, how important it is. So I think, how you're explaining that you guys were the second in the state largest facility that has these types of trainings and works with police officers and stuff like that.
So we do have like a police liaison situation. But when I first started, I don't know that this would be available now, obviously due to COVID, but there was opportunities to do like ride-alongs.
Okay.
And I never got to do one just because I was the nature of my job is like, oh, this person, needs their medications here, so let's drive here now, and you can't plan for it. So sort of a planned outing like that sometimes can't happen.
You can't plan for it, especially when people hit crisis mode. Like, you can't plan for that, really.
Yeah, and I joke that, like, I don't know what I'm going to be doing in my day until, like, I have a vague outline of, like, these things are going to try to be done, but I really don't know what's going to pop up.
Yeah.
But, what was I saying? Oh, crisis. So CRT is also sending out, like, therapists and crisis-trained therapists, embedding them with police officers. And we're trying to educate a lot of people in our community about asking for a CRT-trained officer or a CRT team to respond to a mental health emergency if you do need to call for law enforcement help.
Okay.
Because, and being very clear, I mean, it sucks that this has to be spelled out. However, this was not intended to be the police's job, but there was no other stopgap measure.
Well, I mean, that makes sense. They do. They do take on more than they are even qualified for, and that's no slight. I'm not qualified to do many things, and if someone just threw me into a job that I had no idea of what I was doing, I'm sure I would not be able to make the best decisions.
And the tools they were equipped with were not for de-escalating crisis.
Yes.
And we're learning from that as a society now.
Yes.
Some places are learning faster than others.
Well, and that's why May being mental health awareness month. This is my forefront of the episode for it, and I think that this is a good time to expand on that being aware of how you call in for assistance. If you're not equipped to deal with it yourself and it's a family member and you need help, you need to also realize that when you are trying to bring in even more people to the situation, that it could be escalated and it could get worse. It could get better, but it also, being aware that the people you are bringing into it need to have that type of training is very important. And I'm glad that you mentioned that.
Yeah. Also providing as much context as you can.
Yeah.
And preparing law enforcement or emergency services for what may greet them at the home just helps everybody to be on I mean, of course that doesn't work perfectly or at all sometimes, but it does
better the chances.
I've seen a real change in the way that things are handled, and COVID has once again made that another loop in that, and gosh, it's like there's so many hurdles to mental health treatment. Like I know we touched on that earlier, and it's like the team I work with, we're so used to like having to just negotiate around hurdles to get our jobs done.
Yeah.
That like COVID stuff just became another like obstacle that we were pulling ourselves over.
And a lot of people not having to deal with that on a regular basis, that uncertainty, they lost their minds when it came down to having to deal with COVID and having to deal with those types of changes. A lot of people have had a very difficult time.
Yes.
Having to adapt to that uncertainty and those changes because they never had firsthand experience with it before. And I just hope that it makes our society more understanding as a whole for people who have to deal with this regularly. Like, you guys can go back to things just being normal, quote unquote, and that's fine. But some people who had these challenges beforehand can't just go back to a certain type of lifestyle. They live a certain way. And I hope that this shines a light on that and helps people to be more understanding when it comes down to it.
And people always surprise you, and sometimes it's good and sometimes it's bad surprises.
Right.
But I think that COVID this is for the most part everybody's first pandemic, right?
Yes.
And this is generational trauma that we will all share. And much like 9/11 was generational trauma
Mm-hmm.
for Americans anyway. But this is a whole generation of people that were alive right now during this.
Yes.
That we're all going to share. And so one of the most important elements of understanding and acceptance is empathy.
Yes.
And
exposure. Yes.
Mm-hmm.
I think exposure, and that's I was just listening to this show about this gentleman who works for a international facility, and they go around and try to find ways to educate the community about like child soldiers and
Mm-hmm.
things like that, so that they can be able to provide the environment to help make them successful and not continue to live this life of trauma, or at least give them the best life quality they can have.
Yeah.
And they were learning that education helps, yes, but actually introducing people to the community and explaining their situation, and having them show their life and talk about it really enlightens people and gets them to be like, hey, this is not, obviously I'm seeing firsthand, this is not how things really are. That stigma that's put on mental health gets taken away because you actually meet somebody who talks about it and who lives with it, and it's real to you then.
Yes.
So that's why I think it's important.
It's not a characterization. It's not a two-dimensional character on a screen.
Yeah.
Or an idea or a plot trope.
Yes.
It's a complex individual that's different, just like every individual is different.
Definitely.
And so many themes in my life come back to like our sames are more than our differences.
I would have to agree. And I think that that's what's so important about doing stuff like this, where we just sit here and put out the content and the information and the experience that we have firsthand living in that community, and have firsthand being people who live with these mental health challenges.
Yeah.
And I really do appreciate you coming and talking about this. I really
I'm so glad that somebody wanted to talk about it.
Of course.
Thank you, because mental illness is still a taboo topic, and the more we talk about it, it won't be. Like that's not sustainable.
I would have to agree with you. And I was going to say, do you by chance know offhand of any resources that that we could provide to people in the environment? Like if you do have a family member that needs assistance, or if you do feel like someone's in crisis, what we could...
So I can, do you have like a website or?
Yeah, we do. I can definitely
like
post.
You can post number. Okay.
You can say it now, but I'll also post it, the information.
One of the things that I want to make people aware of just in general, like clearly you are in Colorado and Aurora, Colorado based podcast, but something that people aren't aware of as far as a resource that exists more and more these days are places called crisis stabilization units, or CSUs. They're also sometimes known as ATUs, like an alternative treatment unit, I think.
Okay.
And so what this would be is they're designed for people to come in. There's usually a walk-in model, or can be triaged in through the ER, depending on level of care needed. And it's there for people in crisis.
Okay.
So I can definitely give you the specifics and the address for the one that's in our community.
Yeah, for those of you listening, we'll go ahead and post the information as well with this segment, just so that if you didn't catch that, we'll have it written down and you can find it a little easier. So don't worry about that. And then I actually, just out of, I don't want to call it morbid curiosity, but it might be a little bit, I wanted to hear you talk about some experiences you've had with your clients. Like, I mean, maybe a good one and a bad one, or your favorite or your least favorite, anything you're comfortable talking about. But just...
Yeah, definitely want to keep like everybody's privacy in mind, but there are some like running themes of things that are my favorite and least favorite and challenging and fun about this job.
Mm-hmm.
And let's start with the good, because because this is an extremely rewarding line of work, and I think one of the privileges of my life's work, that sounds, of the work I'm doing with my life, what I feel called to do is that we have this very small caseload, and I get to know these people very, very well, and it's such a privilege, because in a different setting, in any other setting for nursing, you're in a hospital or in an inpatient situation, and you're only seeing people when they're doing bad.
Yeah.
And I get to see people get better and then maybe not do as well, but then get better again, or have sustained. And not only that, but I know people's backstories, and like the context of the individual is so important. Like what the relationship I get to have with people and the relationships I build, especially with clients and at work, are some of the most authentic relationships that I have in my life.
Oh, that's so nice. It does sound really rewarding.
Yeah, but there's also like a lot of systemic heartbreak. When you go to, I joke about this with my boss, when you go to nursing school, it's geared toward like what you think of when you think of nurses, which is like a hospital setting. No nurses want to do psych. I went to nursing school just to do mental health.
Yeah.
My skills wouldn't fit anywhere else.
I know exactly what you mean, because I could never be like an anesthesiologist or like a surgeon or even anything remotely close to it.
I tell people there's a real hierarchy among nurses, and they'll give you yeah, thank God for you doing that. I could never do that. But I like think that about like nurses that work with children.
Oh, yeah.
Just like, oh, God bless you for doing that. I couldn't do that.
You were doing the angels' work.
Or, people who are operating on, like helping with people who are having joint replacements in the hospital, med surg nursing. God bless you. I couldn't do that. That's just not where my skills are. But it's where I wanted to be, and it's so rewarding because of the relationship I get to have, and it makes the advocacy so, like, everybody I work with is such a strong advocate. We come from multidisciplinary places.
Yeah.
But
when you said when you took on this job that it was vacant for like what, half a year, and no one even wanted the job.
So I did my nursing school final, like my God, it's been so long. I don't remember what it's called. It's like your capstone course. So my senior placement, that's what it was called, was at one of these crisis stabilization units, and it was just post the Aurora Theater shooting.
Oh my.
And it was a really inspiring place to be, because this was a facility that was not able to continue running in the weeks leading up to that. And with the overwhelming response for the need for that for the community, they were able to get that funded again. And I wanted to work there so bad. And the nurse that precepted me was like, well, we just hired 4 nurses here, but hey, there's this job with this other community-based team, but I don't think you'd want that job.
Yeah.
Nobody wants that job. But she explained it, and I thought, well, gosh, that's what I wrote my like 20-page nursing management paper about. Like, that's a thing.
She's like, little do you know.
Yeah. And they had offered me the job before I graduated. It had been vacant for 6 months, and this is in June, it'll be 6 years later. They've had me my entire career.
It's so cool how that worked out.
Yeah.
But yeah, I definitely appreciate you taking the time to talk to us about everything. Was there anything specific or anything else you wanted to touch on or talk about, or anything you wanted to say to anybody listening?
It's like when you always know what you want for your birthday until somebody asks you, what do you want for your birthday? You're just, I always have so much to say until somebody tells me, okay, here, what do you have to say?
That's fair.
There's the more people that stand with a movement, the stronger that movement is. And I just want to bring everybody back to the concept that mental health and mental illness touches all of our lives. And if you see a situation that you think you would normally think of as dangerous, or I'm going to cross the street, or because it appears like you're going to come across somebody who's visibly mentally ill, don't.
Yeah.
Don't. That's what I wanted to say was my favorite part of my job, besides the relationship, was we do this thing every year. Well, we couldn't do it last year because of COVID. We're hoping to be able to do it this summer, where we have as many of our clients as possible out to a local park, and we barbecue, and we play hacky sack and throw around footballs and stuff. And it's like the one day of the year where a lot of these clients don't get told move along, or you can't be in this public place.
It almost makes me want to cry, honestly,
It's
just hearing you talk about that, because I know firsthand how uncomfortable it is to be someone out in public like that, and to feel like I don't belong out in society often. So hearing that is amazing, and I wish that we could do that. I want to create that more days of the year, every day of the year. That's the environment I want to foster. That's my message. I think that's an amazing goal, and I would like to, try and be a part of that.
Yeah.
What would you say would be some traits or for someone who wants to go in your field, or like what advice would you give to anybody who does want to enter into this field, or just provide assistance, or be an ally of the mental health community?
An ally, absolutely. I think that a lot of us, sounds like you and I were both impacted by mental health treatment as young people, and that geared us toward wanting to make a difference for other people who've had the same treatment.
Definitely.
And who have the same struggles. And I'm sorry, my thought just derailed there.
I gotcha.
ADHD is another one of my struggles. I'm sorry, could you redirect me?
No, you're good. I was just saying that if someone wanted to...
Oh, yeah. So if you want to help, Google Community Mental Health Center in your area code, or your zip code, wherever you are. And start there. See if there is a volunteering opportunity. See if there's something you can do to get involved. See, I know that where I work, they provide a community newsletter.
Okay.
And provide updates about community events. And it's more than just a place where a therapy office is. It is literally a community hub. And a lot of mental health centers are like that, and people don't necessarily realize that resource. So that's a really good way to get started. But also, we all either are going through a mental health struggle or know somebody who is or has. And one of the codes I like to live my life by is kindness is magic. And so little kindness and so little understanding goes towards mental health, and not only toward what we perceive outside of us, but also our own.
Yeah.
And I want to tell people to have, especially right now, have kindness and understanding and empathy for yourself as well, because I mean it's chaos.
Yeah.
It's chaos. Even prior to COVID, for people struggling with this kind of stuff, it is chaos and it's isolating. And you're not alone.
And I think that is a beautiful way to look at it, and very realistic, that we all need to just have a little more of that, and just try to be as understanding, even if you don't necessarily understand.
Also, yeah, and I think a lot of people just have forgot where they place their humanity and showing dignity to other people. Dignity and respect to other people.
Yeah.
And, it's very easy for us to get involved in our own little sphere and our own little worlds and not see much outside of it. But I don't know, I'm rambling. Just, it's chaos. Be kind.
Yeah.
That's not my quote. That's Michelle McNamara, but it rings true. And I think how would you, if you can be in the moment enough to think, if it were me or my loved one, how would I want somebody to respond to me?
Yeah. And I think that is very, very good advice.
And you don't have to understand in order to listen.
Yeah, for sure. Yeah, that's the greatest part about it, is you don't have to understand to provide the environment. And that's all that I ever try to get out there to my listeners. Thank you again, Jamie, so much
Thank you so much for
being a guest
me
on my show. And I really appreciate everything, all the information you've given us today, you taking the time to talk about your life and your experience and how much you do for people like me. And I think that you are a gem. And I really appreciate you being here. Thank you so much.
Thank you.
All right, everyone. Thank you for listening. This is your host, Diana, signing off for Cathartic Ruination. You guys take care. Hey, everyone. Thank you for listening to another episode of Cathartic Ruination. This is Diana here, giving you some local mental health resources. If you live in the Denver or Aurora area and are experiencing a mental health crisis, you can text TALK, that's TALK, to 38255, or go to the Crisis Stabilization Unit at 2206 Victor Street, Aurora, Colorado, zip code 80045. And that's on the second floor. If you are anywhere in Colorado, you can dial 211 for local resources, or if you feel like you don't know where to start and need some help, you can email me at catharticruination@gmail.com. That's CATHARDICION@gmail.com. I know that it's normal to feel alone in your struggles, but there are people who want to help you. Don't be afraid to reach out. Take care, guys.